Well, I'm Jagender Rana, and the topic for our discussion today is telemedicine in India. Telemedicine in India. The society is developing rapidly in different fields such as education, employment, IT field, which also include health and medicines. The integration of telemedicine into the healthcare system has revolutionized medical practice in India, providing greater accessibility to healthcare services across geographical boundaries. However, this growth comes with significant medico-legal challenges. The legal framework governing telemedicine in India is focusing on the implications of telemedicine practice guidelines 2020. It examines issues related to doctor-patient confidentiality, informed consent, liability, data protection, and the standard of care expected in telemedicine. Further, they aims to provide a comprehensive understanding of the regulatory environment, identify potential legal risks, and propose measures for mitigating them to ensure safe and legally compliant telemedicine practices. The definition of telemedicine has been defined by the WHO, that is World Health Organization, via the Guide to Telemedicine in Primary Health Care was developed with technical and financial assistance from UNICEF Romania under the project defines it as innovative tools for the improvement of local healthcare delivery capacity. The project that has been shaped and implemented by the Center for Health Policy and Services Foundation. So, as the delivery of healthcare services using information and communication technology for the exchange of valid information for diagnosis, treatment, and prevention of disease and injuries, research and evaluation, and for the continuing education of healthcare providers where distance is a critical factor. So the telemedicine practice guidelines, which were published by the Indian government in March 2020, are now part of Appendix 5 of the Indian Medical Council Professional Conduct, Etiquette and Ethics Regulation 2002. So important facts related to the telemedicine who can practice telemedicine. The telemedicine consultations may be conducted by any registered medical practitioner who is registered with either the Indian Medical Registry or the State Medical Register. As of right now, no particular qualifications are needed, but in order to allow an RMP to practice telemedicine, the government intends to launch an online course that must be completed. So to enable all those RMPs who would want to practice telemedicine get familiar with these guidelines, as well as with the process and limitations of telemedicine practices. An online program will be developed and made available by the Board of Governors and Supervisor of Medical Council of India. So all registered medical practitioners intending to provide online consultation need to complete a mandatory online course within 3 years of its notification. In the interim period, the principles mentioned in these guidelines need to be followed. Thereafter, undergoing and qualifying such a course as prescribed will be essential prior to practice of telemedicine. Now, as far as the application of telemedicine is concerned, the RMP has been given the freedom to decide this depending on the complaints, the patient's condition, the necessity for visual or oral interaction, and the resources that are available. So the RMP retains the right to suggest an in-person consultation if he believes one is necessary, and to go forward only following one. So any appropriate telemedicine tool, including phone, video, LAN, WAN, internet, mobile, landline phones, chat platforms like Facebook Messengers, Facebook messengers and WhatsApp, mobile apps or other digital platforms like Skype, email and fax can be used by RMPs, that is registered medical practitioners, for patient consultation. So the fundamental ideas of telemedicine hold true regardless of the communication medium employed, based on the manner of communication, the timing of information transmission, the goal of consultation and the type of interaction between a registered nurse and patient, caregiver, or between an RMP and another RMP. Telemedicine applications can be divided into four fundamental categories. So, guidelines for telemedicine in India. An RMP is in a good position to determine if an in-person assessment is required or if a technology-based consultation will suffice. The practitioner must use appropriate judgment and not cut corners when it comes to patient's care. So 7 factors must be taken into account before starting any consultation via telemedicine, because the telemedicine applications are mode of communication, timing of the information transmitted, purpose of the consultation and individuals involved. These 7 elements to be considered before any telemedicine consultations are context, identification of RMP and patient, mode of communication, consent, type of consultation, patient's evaluation and patient's management. The patient and RMP identification means anonymous telecon situations are not allowed. At the onset of the consultation, the RMP is required to provide his identification and qualification. Additionally, the patient's name, age and identity must be expressly verified by the RMP. Consent is assumed once the patient starts the teleconsultation. The patient must give approval before the RMP can start a teleconsultation. The patient may give this clear consent by texting, emailing or making his intention known over the phone or via video. Ethics and secrecy. RMPs are required to follow the same medical ethics as stipulated in the Indian Medical Council Act. These principles include upholding professional standards to protect patients' privacy and confidentiality. So this mandate encompasses their utilization of technology services in addition to their clinical practice. When using technology services, RMP should proceed with a reasonable degree or caution to avoid violation of patient's confidentiality or privacy. As needed for in-person consultation, the RMP is in charge of keeping track of the teleconsultation, patient's information and prescription information. Specifically, in case of prescription is shared with the patient, the RMP is required to maintain the prescription records as required for in-person consultation. In the case of Deepa Sanjeev Pavaskar and others versus the state of Maharashtra, a new mother went to the hospital the day after she gave birth, experiencing significant vomiting. So the doctor gave her treatment recommendations over the phone without properly diagnosing her after a nurse checked her. The doctor's prescription of medication without a complete medical evaluation was deemed irresponsible by the Bombay High Court, as the patient eventually died from a pulmonary embolism. In another case involving actor Sushant Singh Rajput's death, the prescription of clonazepam via teleconsultation was contested in court. Since clonazepam is on the prohibited list, its procurement through telemedicine was deemed illegal according to the telemedicine practice guidelines. So, types of the consultation: first consultation and follow-up consultations are the two categories of patient consultation. So, when a patient is seeking teleconsultation for the first time without having previously had an in-person consultation, an RMP may only have a limited understanding of them. But if the initial consultation occurs through video, RMP can make far better decisions and as a result offer considerably better guidance including more medications if necessary. On the other hand, if the RMP has previously visited the patients in person, there may be more thorough in the patient's care. First time consult, there are three conditions when the consult is considered as first time consult. The patient is consulting with the RMP for the first time, or the patient has consulted with the RMP earlier, but more than 6 months have elapsed since the previous consultation, or the patient has consulted with the RMP earlier but for a different health conditions. So follow-up consults. The patient is consulting with the same RMP within 6 months of his or her previous in-person consultation, and this is for continuation of care of the same health conditions. However, it will not be considered a follow-up if there are new symptoms that are not in the spectrum of the same health conditions, and our RMP doesn't recall the context of previous treatment and advice. So, limitations of telemedicine in emergencies, because telemedicine should only be used for immediate first aid, life-saving measures, counseling, and advice on seeking further care. It is not a substitute for in-person care when it is available. Encouragement for in-person care, even in emergencies where telemedicine is used initially. The patient should be advised to seek in-person consultation with an RMP as soon as possible. So, rules on the prescription of the medicines. The registered medical practitioner must use the same degree of professional judgment and accountability when prescribing medication through telemedicines as they would be conventional in-person consultations before writing a prescription. The RMP must make sure they have gathered enough data to make an accurate diagnosis or a provisional diagnosis. So in telemedicine consultation, the same diagnostic method should be used if a person calls for it in an in-person environment. So a few months back, Bob fell and hurt his knees. Since Bangalore was under complete lockdown, he decided to consult an orthopedic clinic. So the doctor heard Bob's problems and prescribed medicines and physiotherapy for 3 weeks. And no physiotherapist was willing to come home. Bob came across an online physiotherapy app that took care of his needs, and soon he was cured. So this illustrates telemedicine services, the innovative answer to tackle India's healthcare needs. And India is witnessing breakthrough technological advancement, and that are sharing in a new healthcare paradigm and transforming lives for the better. But telemedicine, a fairly new concept, allows patients to seek doctor's advice via video that using myriad communication channels like mobile, laptop, and wireless technology. With the virtual diagnosis of the patient, online prescription of the medicines, and remote care for patients via telemedicine is not only enabling the 3 A's of affordable, accredited, and accessible healthcare, but also paving the way for the 6 P's of healthcare, that is personal, primary, preventive, decision, proactive, and predictive healthcare. So the telemedicine concept has come to a long way from Indian Space Research Organization's telemedicine pilot project in 2001, increased significantly in the current pandemic-induced era, and it promises to grow exponentially in the coming years. So fast exchange of patient information, timely advice, and last mile connectivity with patients are some of the reasons for its growing demand. The Indian market is expected to reach $5.4 billion by 2025 with a compound annual growth rate of 31%. In India, public health access to primary health care and sanitation emerging gradually, while some states are making great strides in ensuring that basic medical facilities are available. to the masses. They are often confined by constraints like lack of awareness, locational access, budgets, poor facilities, and trained staff. So almost 60% of the Indian hospitals are in urban areas, which is home to just 32% of Indian India, while the remaining 68% of the Indian population resides in rural areas, so where access to good hospitals and doctors are limited. Telemedicine therefore has the potential to provide quality healthcare to everyone. With the Finance Ministry's Union Budget 2021 allocation of INR 2.23 lakh crore for healthcare, which is an increase of 137% from last year, the sector is expected to record robust growth. Meanwhile, with the new normal age bringing about the unprecedented digital transformation, the rise of telemedicine as an answer to the public health gaps is poised to usher in a new era, aligning with the government's Digital India mission. As doctors can provide consultation and write prescriptions over a phone call, it can help in spreading awareness and also decreasing the load on hospitals. This also ensures a clear demarcation of the critical and non-critical ailments. While critical patients must visit hospital, non-critical ones can avail expert opinion from their homes, avoiding unnecessary burden on hospital staff and save commuting time. Sometimes the shortage of hospital beds makes hospitalization tricky, and such cases consultation can be helpful provided the patient is not critical. The telemedicine can also tackle inequity and lack of healthcare access for rural women who often shy away from availing of basic medical care of themselves. In such cases, a portable telemedicine kit can ensure availing telemedicine service on the go and enhance healthcare, empowering healthcare professionals and patients. Like Hitachi MGRM Net has developed a lightweight, sleek and portable telemedicine kit that holds basic things like blood pressure monitor, pulse oximeter, fetal Doppler, ECG, etc. Thank you very much.